So in Australia, medicine is doing a lot right. But where we've fallen down is that the last decade or two of our lives is spent in illness, not in wellness.
I'm Jo Clark, and thanks so much for joining me today. This is the Redefining Midlife podcast, a podcast designed for the 40-plus woman who is determined to challenge society's myths and beliefs around midlife. It's for the woman who is inspired and ready to define midlife her way. Join me each week as I chat to health and wellness experts for up-to-date information on how to live well, as well as some special conversations with incredible everyday women redefining what midlife can look like. Here's to making our next half of life even better than the first. If you want to know how to best support your health right now, as well as how to live a long and healthy life in the future, then this is the episode for you. My special guest is Dr. Sharon Kolkka. Dr. Sharon is a women's health and preventative healthcare strategist, author, speaker, and medical practitioner. She's not just a medical doctor. She's a visionary in the field of longevity medicine. And with further postgraduate qualifications in nutrigenomics and environmental medicine, one of Dr. Sharon's key areas of expertise is understanding how our unique genetics and lifestyle choices impact our ability to thrive in our stress-driven society. She's conducted extensive research and has presented her findings in a variety of seminars, making her a highly sought-after expert in longevity medicine and nutrition. Alongside all of this work, she has also co-authored a fabulous book and go-to guide with Sharon Kolkka called How to Be Well, a Handbook for Women. Now, with over 35 years of experience in clinical practice, Dr. Sharon firmly believes in the power of evidence-based medicine, and she's dedicated her career to unraveling the connection between lifestyle choices and health outcomes. And as a founding medical advisor for Wingana Lifestyle Retreat, Dr. Sharon continues to share her knowledge through regular workshops on integrative medicine, women's health, and longevity. Her expertise has also attracted the attention of Australia's highest profile celebrities and elite Olympic athletes who seek her guidance as a medical consultant. Now, I first came across Dr. Sharon when I attended a women's health retreat at Wingana back in 2021. And her approach to preventative healthcare and emphasis on self-responsibility resonated really deeply with me. It's what I believe in and what I personally practice. And I also teach these principles and support women as they implement these principles in my Better Than Before membership. Now, Dr. Sharon and I talk about so many key health topics that are incredibly important for all women in midlife. I know you're going to get so many gems and takeaways from this conversation. And when you hear about Sharon's own personal experience of blue zone living, it will definitely inspire you to think about what small changes you can make in your life. Now, I really encourage you, share this episode with at least one other special woman so that they can also be empowered with this important information. Now, you can find all of the links to Dr. Sharon in the show notes. After you listen to this episode, I'd really love you to send me a message and let me know what your biggest takeaway was. Let's get started. A very big welcome to the Redefining Midlife, Dr. Sharon. It is so wonderful to have you here today, and I'm looking forward to you sharing your incredible wealth of knowledge with us all today.
Thanks, Jo. It's wonderful to be here because I know that this is such an important topic for you and for me and for your listeners.
Absolutely it is. Now, Sharon, you are an expert on women's health, and over the course of 30 years, you've worked as a medical doctor and a herbalist. You've got degrees in medicine and surgery and postgraduate qualifications in nutrigenomics, obstetrics, and nutritional and environmental medicine. That's a lot that you've packed into your 30 years. You've also lectured internationally on nutrition and health issues. You've hosted seminars at Wingana, which is Australia's leading health retreat. And that's where I met you a couple of years ago and came across your amazing work. And just in your spare time, of course, you've written 2 books with another one that's on the way. So before we get into your chat on health and wellness, I'd really love to know what first ignited your interest in medicine, and then what led you in particular to go down this path, which is very different from a lot of other doctors.
The the first seed with medicine was almost accidental. I really, really wanted to be an Indonesian language teacher, but I realised early in my working out the career pathways that that probably wasn't going to give me enough options for my brain to actually be satisfied with that particular career. So my first choice was medicine because I predicted that I could reinvent myself several times over the course of my career, as I did in that particular profession. And my fallback was science law. And I was looking at then joining the police force and becoming a police prosecutor, which was interesting. And that came down through my dad, who was a policeman. So I had that sort of family influence there. But I got into medicine. So that was set me on that path.
And then in particular, you got into the area of women's health and obstetrics. What was that catalyst? Because once you start, of course, doctors then decide what their specialisation. So why that area?
It was one of the things that I was very interested in as a medical student, and I had some really good teachers in my obstetrics as a student. But I also realised that I wanted a family, and again, at that stage, I think I was looking at how can I have both without compromising either my career or my ability to be a mum. So over the course of my first couple of years in general practice, I saw that there was an opportunity to do a postgraduate training course in obstetrics and become a GP obstetrician. And at that time, I was working in Queanbeyan District Hospital, a little country town, but literally 10 minutes away from the tertiary hospitals that gave me a lot of confidence and support when I looked at the obstetric practice that I'd want to actually commit to. So I went to Wagga Wagga and did my obstetric training with an exceptionally good team of doctors and midwives, and then came back to Canberra and, more importantly, Queanbeyan District Hospital, and delivered babies there for roughly about 10 years. And because I was one of the very few female obstetricians in the region, I ended up in my last year of doing obstetrics being busier than the obstetrician, the specialist obstetrician in town, because women just, enjoyed me as a coach and as a presence when they delivered. So it was an exceptionally busy time. And I also, in that same period of time, I fell pregnant with my first child, Hannah. And there's an interesting story there, because I was doing my obstetric training out at Wagga, found out I was pregnant, and we'd been trying for 4 years. So this was quite delightful. And then, because I was still working horrendous hours and getting up in the middle of every single night delivering other people's babies, I ended up in threatened premature labour. So in hospital myself, back at Royal Canberra Hospital. And it was the time when I was supposed to be doing my practical exam to get my obstetrics diploma. And it just so happened to be in the ground floor of the hospital that I was an inpatient with. So I had a drip in one arm, and I actually talked my consultant, the person who was looking after me, to letting me go down and do the exam. So I had a drip in one hand and I was in a wheelchair, and I was at that stage 30 weeks pregnant. And they passed me. I think they thought, well, she must know something about obstetrics. Look at her. They felt sorry for me. But in retrospect, I look at that and think, boy, I could have been a little bit smarter with that choice.
Yeah.
But having said that, I did end up being an obstetrician for the 10 years and enjoyed it. But along the way, I actually fell pregnant with my second, and that took me 3 weeks, and it was almost an accident with Michael. But it made it okay to be an obstetrician until they were at school. I had a full-time live-in nanny, and I didn't try and do it all. And I think that's an important take-home message for younger women, that you can have it all, but you've got to compromise in some areas. And it wasn't until my kids were perhaps in, early and middle primary school that I realised that the nanny was not who they wanted at their speech night and at the other show and tell times in school. So I stopped doing my obstetrics then, and it was with reluctance, but I had then a commitment to my kids. So that was sort of my early experience as a woman's health doctor. And once I stopped doing obstetrics, I could still involve myself in their antenatal care and women's health and hormones and getting women pregnant. And that basically ballooned into the practice that I had when I moved up to Queensland in the late 1990s.
Mm. Well, it's just interesting when you look through all the things that you've done. You know, you're obviously just curious by nature. That's part of who you are innately. You've got an absolute love of learning because you've done so many things and just need that constant learning. And you're ambitious. So putting all those things together, like I can see how how you've gone in different areas in your life and in your career. It makes a lot of sense now that you've started to explain it and I've read more. Yeah.
And it is interesting because I came up here also with the purpose of using more integrative medicine. And when we use that term, I'll explain what I mean by that. It's looking at the integrative and complementary medical modalities, and that includes your herbal medicine, your vitamins and minerals, and acupuncture and other modalities that are not mainstream medicine, but nowadays has a lot of good evidence to state that it's really going to help a woman become optimally well. But I'm also aware that I'm a medical doctor and I have to keep Dr. Karen's hat on her head when I suppose, create a management plan moving forward for women. So I stay in evidence-based medicine. But what a lot of my colleagues don't know is that gratis of the internet, there is a lot of evidence out there, research papers that tell me, for example, it's a sound decision when I've got somebody with mild to moderate anxiety or depression sitting in my room, that I've got just as much chance of getting them feeling well by prescribing St. John's wort as I do if I write a prescription for Prozac or a formal antidepressant. So discussing that with the patient and getting their input on what they would like as the passage forward means that I can look at those less side effect provoking options for them that has just as much of a chance of getting them well as a prescription pad. And I think the other thing too, it's very difficult to do that in mainstream general practice because there's not that time that you have to sit down and talk about the issues, the pros and the cons, the evidence and the other side effects. It's much easier to write a prescription for antidepressants. So our system is set up so that it sort of skews us into needing to write prescriptions for something that could perhaps be managed in a more holistic or natural way. So that I couldn't have done if I'd have stayed down in Queanbeyan or Canberra. I wanted to start to incorporate those options into my practice. And interestingly, it's a very conservative area in Canberra in that region. And I wasn't prepared to have the battle that I would have faced if I'd have stayed in that region. So I came up here where I suppose we have a little bit of the Nimbin influence on the Gold Coast, where there's a great acceptance of natural therapies. And in fact, for a lot of people, I pushed to want to look at them first. So I didn't have to do as much talking into when it came to looking at options of natural first versus pharmaceuticals.
Are you finding just so this is for my own interest, are you finding that the people that you're coming across now, patients, are more open, or people in general more open to more natural therapies or what was once considered, out there therapies, rather than just going straight for, right, I want a prescription?
Yes, and sometimes you're absolutely right. But sometimes I actually then have to counsel them to say, no, in this circumstance, the drug is the right choice.
Yeah.
So yeah, I suppose I'm the one who sort of counsels them into the pathway that is going to produce the best outcome. And sometimes that's take the drug.
Yes.
But I think that when you're looking at what I did as a part of the training to be able to do that and to look at those options is I did a training course through, it's a company called MediHerb that now produces a lot of the very high potency and high standard supplements in Australia. But they did a course on what they call phytotherapy, which is herbal therapy. So I made sure that I was well trained in that area rather than just sort of dabbling and trying to fumble me through what is quite a complex area of pharmacology when we look at the herbal medicine and the herbs that we can choose as herbalists to help us do a job that we would otherwise have chosen a pharmaceutical to do.
So it basically gives you as a doctor more tools that can help people. You're not confined. Yeah, you're not confined to just one type of a drug. You then have a lot of different alternative therapies that you can use.
Yeah, exactly right. And it's interesting when you go down that rabbit hole and look at natural therapies and start to look at the mushrooming evidence on their efficacy, the way they work, and now understanding how they work. It blows my mind sometimes at how powerful natural products are. And more recently, when I've started to dabble in an area called nutrigenomics, which is looking at how your food interacts with your genes to either support wellness or sabotage you, I'm in awe of food. And I would almost certainly nowadays start with food-based options that have good evidence to work, rather than even going into the supplement or run them together for a while. But it comes down to diet, and it comes down to everything that you put in your mouth speaks directly to your genes, and you want that language to be really nice and polite, not screaming like an AC/DC concert.
It's a good visual. And that so totally makes sense. And we'll go into that in more depth, so further into the conversation. But that's right. When you're talking about food, and this is where I'll be bringing into this next phase of the conversation. I'm a big advocate myself, and personally, and the women that I work with, for self-responsibility when it comes to our health. So can you explain why this is so important for everyone, particularly for women who are in the middle of life? So for the 40+ woman, why should they really be focusing on this now?
It comes down to the fact that nobody is going to be more interested in their health and well-being and future than they are. And again, the way the medical system in Australia is set up, we do wonderfully well, by the way. We're in the top 3 with regard to longevity, if you're looking at population. So in Australia, medicine is doing a lot right. But where we've fallen down is that the last decade or two of our lives is spent in illness, not in wellness. And this is where somebody who doesn't take responsibility for themselves and looks at diet and nutrition and stress and toxins and all of those things that we speak about at Gwingana is not going to be optimally well moving into their 50s, 60s and beyond. That comes from self-responsibility and choices that no doctor can make on their behalf. So I think if we look at the big things that are going to challenge women moving into the next 50 years is keeping cognitive health up and running, because dementia is now the #1 killer of women in Australia, and being proactive about cardiovascular health, because that's #2. And even though doctors have a great treatment modalities for heart disease now in both men and women, we still don't have optimal well-being if we don't look at diet as an integral part of cardiovascular and cognitive health moving forward into the second half of our lives. And I don't think that you're going to be able to get the information that you need from your medical doctor, who is so busy treating the very sick that they have very little time to advise the worried well, or the ones that just need that extra arm in their treatment plan moving forward, that looks at nutrition, what they're putting in their mouth, and how to manage their stress better.
Yeah. So you co-authored your second book, How to Be Well, which was a handbook for women with Sharon Kolkka. And I bought that book. It came out probably 12 months after I was at Gwingana. It's a fabulous resource for women as a starting point for them to learn more about this preventative health care. Why was it so important for you both to write this book? What was your big why?
Yeah, it was interesting. I suppose there was the opportunity because we both have a very good friendship with Julie Gibbs, who was previously the health editor with Penguin. And she was on our backs to say, look, you've got to share your information. Karen and Sharon, you've got to get together and co-author this book. And as COVID hit, and it was interesting. It was a gift of COVID to us. Up until then, we said, yes, 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 Julie, we're going to write a book, we're going to write a book. But it wasn't until life stopped and we were off that merry-go-round that we realised that we actually had opportunity to do so. So Sharon and I became one in a bubble, and we started to put together the philosophies that we had learned from life, and also her invaluable contribution, what she had learnt from the guests at Gwyngarna and her life in that more stress management and movement sphere, and as general manager of Gwyngarna over the course, it was 17, 18 years at that stage. And she has a beautiful tone of writing so that she could soften up my cut and dry medical information and make it into a book that women would actually enjoy reading rather than be a little bit confronted with. So the two of us as a collaboration, we produced Be Well, and we're both incredibly proud of the book, and also the life-changing information that is in that. And we have had hundreds of women contact us, basically telling us how much a transformation was the information in that book. And one woman in particular, when we were looking at cardiovascular health, we recommended that women have a coronary artery calcium score that looks at whether they've got calcium and inflammation of the coronary arteries that can predate a heart attack by a decade. And one of the women went and had that done, and she found a problem that she would have otherwise not uncovered. And her husband also went along and had his done, and he was in hospital within the week having his coronary artery surgery because he was on the verge of having a heart attack. So that was an amazing thank you letter that we got from her family, so that we had a husband and wife who had both done very well, purely because they'd been, I suppose, reminded about preventive work and how you can look at cardiovascular health in a preemptive way rather than a reactive way.
Yes.
And that's what we've got to get instilled in people these days. We're reactive to chest pain. So if we have pain in our chest, we're going to go to seek a doctor. But really, we should know what our coronary arteries are doing well before that happens and well before the heart attack happens.
Yeah. And they're such important pieces of information that a lot of people aren't aware of.
That's exactly right.
When they go to see their doctor, it's not looking at, they may not go to their doctor with this in mind at all, going for something else. And so that never gets discussed. But yeah, so for today, someone listening to this, they might now go and ask their doctor if they can have a referral to have this test done.
Yes, and it's interesting. I've been doing it with in my clinical practice for women for over 15 years. And when I started to first do that, it was one of those tests that was quite well recognised over in Europe, but it wasn't a standard test in Australia. And it's only been in the last 4 years that interventionist cardiologists, preventive cardiologists, are actually using that routinely in their patients' workup. And again, uncovering some problems before the heart is damaged and treating it before there's an established heart attack.
Yes. And once you know, when you've had a test like this, you can then monitor it. You can only monitor what you measure. So that's something that's really important to have that bit of information for yourself. So Karen, what is, in your experience as a doctor working with women in their 40s, in their 50s and beyond, what do you see as some of the biggest issues that they face when they come through your door? Or what are some of their common complaints or most common ones?
Okay. Almost without
get a cup of tea.
Almost without exception, if I had to say what is the most common presenting problem, it's the result of stress, which then creates anxiety and depression. And that stress is almost an inevitable part of being a woman in her 40s. And if you look at what's happening there, if she has children, they're getting to that stage where they're rebellious. You've got kids that you're waiting up all night to come home, or they're trying to work their way through the glandular fever that they got in their year 12 just before they were supposed to sit the biggest exam of their life, or they're reassessing where they're at with their career, with their motherhood, and with their relationships sometimes. They've also got aging parents, a lot of them. And then to add insult to injury, the hormones start to rear their head. And once again, it's a time in late 30s and early 40s where we start seeing significant hormonal change that may be reflected in a change in period cycle. It may be reflected as really heavy periods, absent periods, erratic bleeding, and it can also be a hormonal roller coaster with regard to emotions. And that all hits at the same time. So it's a big one for women, that transition through the 40s to menopause and beyond. There's so many things going on so many different levels that it's hard to know which one is contributing the most to symptoms that are happening in that woman's day-to-day life.
It's huge, isn't it? Multiple transitions at the same time. It's it's really quite it's something you just think you've got over one hurdle and then there's another couple that come your way. It is a tricky time. So many other women, and you discuss the menopause transition, so during perimenopause and then postmenopause, so many women experience many different health issues and symptoms due to this time of life. And we know there's more information than ever before. We can get anything that we want to find out, but some of that information may be fear-based. It may be biased. It could be market-driven by companies who are jumping on that menopause bandwagon and seeing it as an opportunity to make lots of money. So it's confusing and overwhelming. And I know you're currently co-authoring another book with Sharon on this particular topic.
Yes.
Can you explain some of these treatment options for women who are experiencing symptoms? What's actually out there that you can see as evidence-based can really help women?
I think what I'm going to do is to twist it to the HRT, the estrogen replacement story, because I've been in this game long enough to see HRT being presented to women as the panacea that's going to cure all of our ills through the early 2000s, where within a week women were told to throw their HRT literally in the toilet and flush it down and don't ever go there again, to a 180-degree turn that started around 2018 to we've got to take HRT again. And I can see that, and it's very confusing, not only for doctors, but for women as well. And point in question, I had a lady come to see me when I was in country practice not so long ago, doing a bit of work. And she brought me a little tube of a gel called Sandrina, which is estrogen replacement therapy. And she said, my girlfriend's on this, she said, and I've been using it and I feel a lot better. So I want to have my own supply now. And when I went through the pros and cons and her suitability for it, what she had had in her past health, she'd had several deep vein thromboses, and one of those clots had made its way into her lungs and put her in intensive care for a couple of days. And that history in your medical past is an absolute contraindication to estrogen, because the estrogen will actually create the scenario where that becomes another possibility yet again. So we talked about that, and she elected not to have the HRT because she remembers how sick she was with that. But it's important to know that there are medical conditions where we cannot consider hormone replacement therapy. The risk-benefit analysis has changed in the last 5 years. And the reason why it's changed is because we're really good at treating cardiovascular disease and making it a chronic disease rather than something that will kill women. But we don't have anything to offer pharmacologically for dementia and for cognitive decline. And nowadays, most women, if we look at the majority of women at the end of their life, what they're going to see on their death certificate, it's going to be dementia. So now we come and look at hormone replacement therapy in menopause, in that 12 months where you're going through menopause, as significantly reducing future risk of being diagnosed with dementia. So the risk benefit of, are we going to give this woman breast cancer, becomes less of an issue, because we know how to treat breast cancer and we can cure it most of the time, or become a chronic disease that will not be the thing that will kill you at the end of your life. but we've still got this little beast called dementia, for which we at the moment have no pharmaceutical or options to treat. So it's sort of like picking the lesser of two evils for women, but the risk for breast cancer is still present. And I don't want that to be underplayed when a woman goes to her doctor to see whether she's suitable for estrogen replacement therapy, which is menopause treatment. So that's an important thing to get out there, that it's not as clear cut as a lot of the Instagrammers would actually say it is. There's still a lot of medical understanding and risk benefit analysis. And at the end of the day, that woman has to make that decision for herself. Having said that, there are the absolute contraindications where doctors will not write a prescription, and that deep vein thrombosis scenario was one of them. So it then becomes a consideration of, right, breast cancer risk. What's your risk as a woman in your family of getting breast cancer over the course of the next few decades if we do put you on estrogen? And a woman has to be comfortable with that risk in order to go ahead and take a HRT. But if every woman and person in your immediate family tree died of dementia, you'll take the HRT and deal with the breast issues. So it becomes a very individual decision, I think.
It's not a one size fits all, is it? You've got to look at your own circumstances, your own health needs, requirements, past histories.
Correct. Yes, correct. The other thing too, I think that a lot of women underestimate how powerful natural choices can be. And there are a few herbs that have got really good evidence base, for example, for the hot flushes that, can be a really disabling, quality of life destroying symptom of menopause. So I would say at the moment, because integrative doctors are really hard to come by and really hard to get into, don't underestimate an experienced naturopath with a special interest in women's health to guide you through that quagmire of herbs that can actually help you move forward and lead a vibrant and hormonally settled life postmenopausally. There's also this grey area, and I'll talk about it because it's something that a lot of your listeners will be familiar with, the bioidentical hormone arena, where hormones are compounded in an individualized basis for each and every woman, and that prescription is dispensed by a compounding pharmacy, and you can throw any hormone into that particular daily dose that we feel is appropriate. So we can use progesterone, which is a balancer of the estrogen effects. We can pop estrogen in. We can pop a little bit of the energy drive libido hormone in testosterone. And we can also use an adrenal hormone called DHEA. And that tends to be a little bit more of a subtle hormonal support through menopause that can be transformed by your own body into testosterone and a little bit of estrogen. So there's a lot of art to that, but the minute we start fiddling with estrogen, we start raising breast cancer risk and we start reducing dementia risk. So again, it comes back to looking at that risk benefit, even when we're looking at naturally derived, wild yam derived bioidentical hormones that are in those compounded products.
Yeah, there is a lot to consider. So basically, women just need to learn more. And that is, again, your own personal responsibility, and with the help of a doctor that you are comfortable with, who is knowledgeable in this area as well. But it really is. We have to take charge of our own health and our future health by looking at these things, because, as you discussed, brain health is so very important, particularly to start looking at this now, because by the time you have dementia, and the work of Dr. Elisa Mosconi coming out now, which is so interesting when she's looking at brain health in women and discovering that why women seem to have far more incidence, and she's, with her research and her team, finding it starting decades before in this age group.
Oh, absolutely. And this is where, it's never too young to start looking after your brain. And there's two things that I wanted to throw out to women. The first is the impact of alcohol on both brain health and hormonal balance, because I can guarantee you, if you are going through menopause and you drink any alcohol, you will flush that night. And it's important to get that connection and to make an informed decision. Will I have the alcohol, or do I want a good night's sleep? And to also remind ourselves of a healthy amount of alcohol to drink. I'll be the bringer of bad news and say no alcohol is considered safe. But having said that, if you choose red wine over everything else, you cut down the risks associated with that alcohol. And it's because of the beautiful red pigment, the resveratrol, that you also get in your red wine that can somewhat counter the toxic effects of the chemicals in that alcohol. The other thing that's really important, and that I was very sad when I found it out, a work of an amazing professor called Marion Diamond, who was a professor, a researcher, and a lecturer at Harvard University before her death at 94. She was the woman, the scientist, who discovered neuroplasticity. She actually discovered that the brains of all humans can change in response to our environment, that we're not all born with a certain number of nerve cells, and as we age, we get less and less and less until we die, either with enough left to carry us on or we get dementia. And one of the things that she discovered in her research, that is one of the worst things that we can do with our brain, is to multitask. And when I read that, and I read the research, which was very compelling, that she had published, I thought, well, women do not do well in that arena, because we pin a badge on ourselves being the queens of multitasking.
So true.
And men tend not to do that. So her advice from the point of view of looking after your brain cells is concentrate on one thing at one time. Maximum two things at one time, but anything more than that, and you are actively destroying nerve cells in your brain. And I think that that needs to get out for women, because we all multitask, and sometimes it's necessary in order to get that to-do list done in the day. But again, know the price we pay, and know how inefficient it actually is to do it like that. So it's one thing at a time, maybe two, but get that finished. Throw it out of your brain into the inbox, and then start on something else.
Yeah. No, that's a great tip to have. Not always easy to do, but it's something certainly to keep in mind while you're doing something else. There you go. There's your maximum of two things, Dr. Karen. Now, I'd also like to, in our pre-chat that we had prior to this interview, you and I spoke about vaginal estrogen, and many women have no idea that this could possibly be an option. They don't know what it is, how it could be helpful as a preventative measure for some women. So can you explain to us what it is, how it can help, and who might consider using it?
Right. There are lots of ways to get hormones into our body, whether it be pharmaceutical hormones or bioidentical hormones. And one of the ways is by the skin and also by the vagina. Now, in mainstream medicine, to help women with vaginal dryness, we can use a little tablet called Vagifem. It's estrogen number 2. And it goes up inside, and it dissolves over 3 days. That's akin to hormone replacement therapy. There's also the estrogen number 3 called estriol. And the vaginal estriol can be a quality of life saver for a lot of women who are having both vaginal dryness that's either itching or preventing comfortable intercourse, or having problems with urinary control. The current mainstream product that most doctors will prescribe for this is called Ovestin. It's the estriol, estrogen number 3. And it comes in a tube, and it also comes in an applicator. And my advice to women is, if you do get this prescribed by your doctor, throw the applicator in the rubbish bin and use 1/2 to 1 centimetre of this cream on your finger around the business end of intercourse and around your bladder opening at the top.
Uh-huh.
And a little bit goes a long way. Putting it way up the top of the vagina is not where the problem is. And there's very little that will find its way back down to where intercourse is taking place if you're using it for an intercourse problem, or around the vaginal and the urethral bladder opening. So I actually, again, last week, I prescribed this as an ongoing treatment to a 93-year-old woman who, when she stops it, has uncontrollable incontinence, urinary incontinence. And when she uses it 3 times a week, her bladder control is perfect. So you can use it forever. And because it's such a small dose of the estrogen number 3, not the estrogen number 2 that we equate to breast risk, it can be used by most women. The other thing that I think is really important to share today is that if vaginal dryness is a problem and you really don't want to go to your doctor to sort it, organic coconut oil used after your shower, just a tiny little dip of your finger and a smear around the business end, can be just as hydrating as estrogen in that area for both intercourse and bladder control. So a little bit of both is often a good thing to look at. But the coconut oil is incredible.
Yeah, because a lot of women may not realise how common it is. So therefore, they won't speak about it openly or discuss it with their doctor for fear of, for whatever reason, maybe embarrassment. So,
absolutely.
And I can understand for some women why that is the case. So after hearing this, what would you suggest if a woman is presenting with symptoms like this,
Yes.
and you can use
I
it at any age, what would you suggest they do?
I think to go and actually be quite proactive and say, I would really like to consider some vaginal estrogen cream, please. And if you say estrogen cream, then they will prescribe the Ovestin, because the estrogen number 2 is a tablet that goes up inside.
Yeah.
But it's one of those things that is so risk-free that, you know, I'm sure that they won't have a wall of put up in front of them to actually get access to that. The other thing, and I've seen it, unfortunately, it saddens my heart, is that a lot of older women, and by older women, I'm saying women who are probably my age and a little bit older, who go in and talk about intercourse with a male doctor, can actually get this blank wall that says, are you still having sex? And it's so wrong on so many levels to have people and doctors be so judgmental on that level. But it happens more often than it should. And I think that my advice to women is, if you do approach a doctor and you get that brick wall, don't tar us all with the same brush. That find a doctor who has a special interest in women's health, who will not be judgmental and will guide you through that part of your sexual life. And again, it doesn't matter how old you are. If you've got a loving relationship with your partner, have sex until you're 93. Wonderful. It will keep you alive.
Yeah, yeah. More good advice. Thank you, Dr. Karen. Excellent. The next one I would like to talk to you, last question, is to do with another area of specialisation that you have within your practice. And it's with regards to testing and reviewing persons' gene clusters. What on earth does that all mean? How can it impact people's wellness and future health? So dive into that, and I'm assuming somewhere along there, epigenetics comes into play as well, and what that might mean for someone who hasn't heard of any of these words. And my knowledge is very small, so I'd love to learn more about this and what you do.
Right. Looking at health and wellness genes, it's quite a new area of medicine. And when I look at health and wellness genes, I don't want to know about those medically significant genes like your BRCA1, your BRCA2, and there is also a dementia gene called the APO4 gene. I don't really want to know about that in the women who come to see me to look at wellness in general. But we all have inherited genes from both mum and dad that give us an instruction manual on how to do stuff in our bodies. And if we take it with regard to women and menopause and this particular midlife arena, we have certain genes that can either metabolize estrogen on our behalf really efficiently and safely, or fail to do that. And that can be not a bad gene, but a sequence of gene clusters that put us at more risk of estrogen in our bodies. There are also genes that determine how efficiently we clean up the rubbish that our cells produce as a very part of doing their day job. And they will produce these things called free radicals or reactive oxygen species. And it's the housekeeping genes that have the job to go into every single cell of our body and just tidy up the rubbish and take it out before the next day starts. If we don't remove those free radicals, then that gene can start, the cell can start to rust from the inside out. And then it becomes very unhealthy, and then it starts to not do its day job properly. So supporting our housekeeping genes is an important part of staying well. Now, some of us may have been have inherited messages that tell us to make these housekeepers that are not all that great at doing their job. They're lazy housekeepers. Others of us might have inherited from both mum and dad instructions on how to produce these amazing housekeepers who clean up our cells efficiently, easily, and will even do a bit of extra overtime if we have an alcoholic drink at night. It's really important for us to support those natural functions that go on in our cells in order to stay well, optimally well into the future. And we're starting to understand from research that those processes, those gene clusters that keep our cells clean and metabolize our hormones in health, they will impact our ability to live well into our older age. The good news about the research that's going on in this area, which is the area of epigenetics, is that even though those genes that we inherited from mum and dad are set in concrete at the moment of our conception and cannot be changed, this new science of epigenetics tells us that those genes come with an on switch, an off switch, and a volume control. And it's up to us to work out what lifestyle choices, what food we need to eat in order to keep healthy pathways turned on and their efficiency turned up as high as we can manage, even if they're a bit lazy. If we use that housekeeping analogy, we might have inherited really pathetically lazy housekeepers, but if we don't feed them the right currency, if we don't give them less of a job to do with the amount of chemicals that we're ingesting or coming into consideration with our body, those less efficient genes can still keep us healthy into a ripe old age. But it means that our playing field for naughtiness and for poor health choices is much smaller. We will pay a higher price, for example, if we smoke or if we drink excessively, than somebody who has inherited the genetic lottery of life and have sumo wrestling housekeepers who will keep on doing it regardless of what mess we throw at them for them to clean up. So this is the area that I'm doing a lot of work in, and it's an area where I think that my prediction is within the next decade we will have some form of mainstream medicine also look at that and take into consideration those differences in efficiency in these wellness clusters that we see that help us remain well.
So that's a self-responsibility. Pardon me. Sorry, that's a self-responsibility that comes into it again when you find out this information, what you're going to be doing.
Yes, exactly right. And this comes down to, and I'll keep on with the housekeepers. There's three really important sets of housekeepers that we inherit into our cells that clean up the cells. One of them loves to be fed manganese, which is a trace mineral. So if we've got a diet that's rich in manganese because we eat lots of nuts and seeds, not cakes and bickies, then that particular group of housekeepers will be more likely to clean. There's another group of housekeepers that are fed with selenium. So if we have our 2 organic Brazil nuts a day, we're feeding them the currency that they like to be paid in, and they will work more efficiently, even regardless of what their genetic tendency is. And there's a third housekeeper, which is a glutathione-based housekeeper that loves to be fed iron. And one of the things that I learned very early in my mainstream medical practice was that most young women who are having periods are low in iron. So they're putting themselves at risk right from a very early, even teenage age, of not cleaning their cells properly, and that will have an impact on their ability to be well into their 40s and beyond.
It's quite fascinating when you start to delve into that, and again, working out your body, how your body works and what's best for it, but then taking that information and doing something with it, because it's great we've got this information, but it means nothing if you don't start putting practices into place.
And this is where the information and the science is quite complex, but the solutions are actually really easy, but they're non-negotiable. And this is where we come back to dietary choices, to choose not to drink in excess of alcohol and to not smoke. And the price you pay if you do.
That's right. And manage your stresses, because we're not going to stop stress in life. That's just a given. And manage that, and to rest, to sleep. There's so many things that we can do. Move our body.
And there's some lovely, what I call bio nudges that we can get from our smartphones and from our computers that basically remind us, gee, you haven't walked in this hour, so get up and do something different.
Yes.
Give your brain a rest so that you're not overdosing your brain cells with too much information. And listening to your body, using technology for good rather than evil.
And I think some people, and there's a flow on to the next question I have for you with regards to the people who live in many listeners will be familiar because they may have seen either read or have seen the Netflix series on the blue zones.
Correct.
On different areas within the world of clusters of people who live longer and live healthier for longer. So they're not only, it's their lifespan, it's their health span that is sort of walking hand in hand with that. You had your own experience with what you called, when we had a chat with your personal experience, the blue zone life, and what you discovered. I really I found it absolutely fascinating and loved hearing this. Could you share that with the listeners, like your experience with everyone?
Sure. The start of that story goes back to Italy, a little place in Italy called Cesena in 2018, where both Sharon and I went to a conference on wellness in this little Italian town. And there was a speaker there called Professor Marco Pez. And he is a Sardinian doctor, an epidemiologist, who wrote about the first blue zone that was ever discovered in the world, and that was his native Sardinia. He realised when he went to medical school in mainstream Italy that his family was unique, that they didn't have heart disease, that they didn't have dementia, and that his grandparents were still alive and kicking, and his great-grandparents were in their late 100s. So they were 109 and 107. And so he started to think, okay, I'm going to make it my life's work to work out why. And so he chose the specialty of epidemiology. And he, along the way, met Dan Buettner, who is a award-winning researcher and writer, who together basically looked at other areas of the world that have this longevity associated with their lifestyle choices. And the Mediterranean has two. It's got Sardinia and also Icaria in Greece. So I then started to look at blue zones, and as I get older, I'm interested in wellness as I age, as we all are. And I had associated with a tiny little village in the south of France called Villefranche-sur-Mer. And this was an area where they lived like a blue zone person. It was a little village that was built in the 8th century, and the streets were too narrow for cars, so there were no cars. The people who lived there had to walk up a very, very steep hill in order to do anything. So to get their groceries, they have to walk up the hill. To get their fish, they have to walk down the hill and then back up again. And there are a significant number of very elderly women who I observed in this particular village over probably 3 or 4 visits annually. And I thought, gee, you're doing something right. I also love the fact that these older women in their 70s, 80s would get out on the local beach in their bikinis and have a ball with their friends and with community and with picnics and leading a beautiful life, completely comfortable with their aging body. So last year, I booked myself at great expense and great tragedy for myself. I had to spend 12 weeks in this little village doing this longevity study on myself. It was tough, I'll tell you, Jo.
Yeah, I know. Someone's got to do it.
I know. What I did beforehand, though, and it was the lead up to going overseas, was quite busy, as you'd imagine, leaving for 3 months and having to take care of everything that you had to at home. But I did a test that looks not at how old I am from a birth date point of view, but how old my cells are. It's called the Horvath's DNAMH. And I sent that off and I thought, oh, I don't know how well I'm going to do, because I was quite stressed and not making great choices like, I knew I should. So I got that result back just before I left for this 3 months. And it was actually not as bad as I thought. I was 2.5 years younger than my birth date age. I thought, okay, that's better. Went away for 3 months. Now, in that time, I concentrated on living the life of a Mediterranean blue zone. So lots and lots of fresh seafood, fish, which was plentiful. I could walk 200 meters every morning and buy fish that was caught locally in the ocean that day.
Wow.
So I had a lot of fish. It was a pescatarian experience for me. I had bucket loads of olive oil. But I actually drank a little bit more wine than I normally do, because that area is famous for its rosé. It's the Provence is very close. And so I probably had 2 to 3 rosés a week, and normally it would be 1, 2 or 3 a month. But that was fine because it was part of the community and the socializations. I thought, okay, if they are doing it in this village, I'm going to embark on the same sort of routine. I swam in an ocean that had no sharks in it, nothing that was going to kill you. So I do a kilometre or 2 across the Villefranche Bay, probably 3 times a week. And I walked, and I walked, because that's what you have to do. You have to walk for a couple of Ks to get your groceries, and you have to carry them back. So you've got to do that 3 times a week, because you can't carry as much back. And I thought I can understand why these older women are really still very vibrant. They're very physical. They're living independently, because I was starting to feel really, really well. Anyway, I reluctantly came home, and then within 2 days of arriving at home, I did another test, which is a saliva sample, sent it off. And when I got my results back after 3 months, I had actually now become 14 years younger than my birth date age. So I had rewound my biological clock a decade in 3 months without taking the supplements that a lot of the gurus on longevity will say you've got to spend, $500 a month. You've got to take NAC, you've got to take luteal, and you've got to take resveratrol, all of these supplements. And really, my thoughts are, if I'd have taken them and spent $500 extra a month, would I have got any more out of this longevity experience? So what I'm now doing is I'm trying to stay the course with my diet and mimic as much as I can a Mediterranean diet. So there's still a hell of a lot of seafood in my diet, but I'm back to my level of stress that I normally have when I'm busy. And I'm taking some supplements, and I'm going to retest to see whether it's made any difference at all, or made an improvement. I don't know. It's an interesting little experiment.
So when do you take that next test to decide, Karen? When are you choosing?
I think my thoughts would be I'm going to do it in May. And that will be because I didn't start on that till probably February. So I want to give it a good 3 months of being very vigilant about taking it every day. So compliance is an important part of that. And then I'll see, because my thoughts are that it's not going to be as good as living a blue zone life without the supplements. And it comes down to everybody wanting a quick fix. Don't tell me what to do. Don't tell me what to change. Don't tell me what to eat. Give me the tablets. Then I'm going to live forever. And I don't think it's going to work that way.
That is phenomenal, though, when you hear 14 years difference in such a short time frame. And yes, it was an idyllic way to live. And can we replicate that in our own life? No, it's not going to be replicated. But what sort of things could somebody do? Like you mentioned, right, more the fish that you're having, the fresh foods. What else have you maintained apart from starting to take a few of those supplements because you're not over in France at the moment? What else can we do?
Yes. I think dietary wise, definitely. I'm absolutely vigilant with my olive oil intake because I know olive oil is like the superfood for everyone. And you can live a much longer, healthier life if you have as little as a tablespoon a day is all you need in order to get huge health benefits. So I've made sure that my olive oil intake is up there as it was when I was overseas. So I have olives daily as well. Plant-based food is important. So your vegetables become important. And I try to I don't quite hit 665 grams a day because that's the ideal, but I try and hit at least 500 grams of green food and vegetables every day. I take fish oils and I wasn't taking them over there, but that's it, folks. So it'll be interesting to see.
It will be really interesting. Yeah, that
But
was just so amazing to hear when you'd said that. I was expecting
I know.
5 years, but 14 is phenomenal in such a short amount of time.
And I think also, Jo, one of the other things too is that I wouldn't be advising a person with an Asian origin to go to the Mediterranean and to start living like a Mediterranean. I'd advise them to look at what was happening in their ancestral home, and if that was more to do with Okinawa in Japan, then to look at what's happening in those blue zones with regard to their diet, because it's probably going to be more beneficial for their unique genetic landscape. But for most Australians, although certainly the Asian population within our community is increasing, we can look at that Mediterranean style diet as a lifesaver for a lot of chronic disease prevention.
Yes. No, well, that's another tip for ladies to take away from today. It's just what's one thing that they could add? So given that, I'll ask you a few wrap-up questions, and this is one that I'd love to hear. What are your top 3 daily wellness habits that for you are non-negotiables?
Right. The first thing when I wake up is basically I try to do at least 2 minutes of meditation. I can't get any more than that because there's a lot of demands on my time, but 2 minutes of meditation, and I try to get another session of that. And for me, all that is basically mindfulness. It's not anything hoo-hoo. It's basically using an app called Endel, Endel, that I've discovered recently. I used to use Calm, but I've switched over to Endel. To basically bring my focus down. And I think that's helping my brain switch off before I start my day. I always have at least a tablespoon of olive oil per day. And I can put it's a mild virgin olive oil. And I always have at least 30 grams of walnuts, because that has been shown to reduce the incidence of dementia lifetime by 30%. So they're my 3 things.
Now that's interesting because
really important and easy to do.
Well, they are easy to do. And I remember you mentioning the walnuts when I was at Ghana when you said that. So that's become a daily non-negotiable for me as well. Karen, what are you most looking forward to in the future?
I'm looking forward to taking some women over to France with me next March and spending 5 days running a retreat there with my co-author Sharon Kolkka, where we teach these women about the Mediterranean experience and hormones. So it's a hormonal focus, but also a general wellness. That's for the morning. And then in the afternoon, we go and explore the region and see how these people are living such a healthy lifestyle. So that's on my list. And I've just opened the bookings for that.
That sounds phenomenal. It sounds really special. And Karen, what are you enjoying most about this stage of life that you're in now?
I think the fact that I've got, even though I'm busy, I'm actually spending my time on things that are my passion. And I realised, even though I did for 30 years the one-on-one clinical work in a practice, that it's really not my thing. I was good at it, but I'm much better at education. and writing and sharing my my information. So I think that's how I'm reinventing the next decade of my life.
Yeah. Oh, that's great that you're being able to do that. Use your skills in a way that you enjoy to help more people.
Exactly right.
And then with regards to that, just because I didn't ask you earlier, when is your new book going to be released or hope to be released?
We hope that it's released around Mother's Day next year.
Brilliant. Well, I'd love to have you back on then to discuss that book when it does come out. That'd be fabulous if you could do that for us.
Absolutely love to, Jo.
And
And can I say thank you for all of the work that you're doing in this area. It's just such an important area for women's health to get this part of it right so that we can all enjoy our postmenopausal years.
Absolutely. Well, thank you. Thank you for that. And it only happens because I learn from incredible women like yourself. So none of this is really hard stuff. It's just a matter of helping women to find how they can, their own little wellness menu, isn't it? What's going to fit in for their life that's going to help them live the best now and into the future.
Yeah. And we only have to do it one step at a time. You don't have to do everything
That's
at once today.
Yes.
Just create one change, cement it into a habit, and then add something else, weeks down the track is fine.
Yep, so true. And finally, Karen, what do you hope that, and I love asking this question, what do you hope that 80-year-old Karen is going to say about current day Karen?
Interesting question, Jo. I think I want to look back and say I ticked every box that I set out to do. And it's interesting because I can almost say that now. And I think that, God willing, that I will be able to continue to do what I'm doing into my 70s, 80s and 90s, because I really will only be 76 when I'm 90.
Yeah, well, that's true too.
If I keep up this good work. And probably spend a little bit more time with my beautiful community over in France, which is so hard to take.
Yeah, poor thing. Once again, someone's got to do it, Karen. It might as well be you.
Exactly, Jo.
Well, thank you so much for being such a leading light in this area for women, because with all the work that you are doing, the example that you're setting and living by example, it's helping other women to be able to live their best lives as well. So thank you. And thank you very much for being a guest on the podcast today.
Thanks, Jo. Take care.
Will do.
Thanks so much for listening and sharing your time with me today. I'd love you to hit subscribe on Apple Podcast or your favourite podcast app to keep spreading these empowering messages. Please share this podcast with other incredible midlife women in your world. Join me again next week for another redefining midlife conversation. Thanks again for tuning in.